We are blessed today to have Mama Adi in front of us, Mary Timaki, who is a physical nurse practitioner and she's a registered nurse. She has the following qualifications: diploma in general nursing, diploma in midwifery, diploma in psychiatric nursing, including for you again, diploma in community nursing science, and she also has the following post-basic qualifications: diploma in clinical nursing science and assessment, treatment and care, degree in nursing management, degree in medical and surgical oncology, nursing science. So public one additional courses of Mama Kiralemoha. She also has additional qualification in family planning and reproductive health, clinical competency in nursing, initiated managed antiretroviral therapy, basic HIV management, infection and prevention and control, adult primary care, and integrated management in childhood illness. And she also has qualification in ethics in public services. Mama, the floor is yours.
Good morning, everybody.
Morning.
I'm disappointed because the cleaner ones are not here. Teenagers. I assume this information that I'm going to give it also affect them. So I don't know how the information was distributed. But anyway, it's fine because they are already out. But it's also important for them. Okay, as Osman Pina has already said, I was approached by the Mothers Union to come and do awareness on breast cancer. Now, when I come to church, I see also the prostate is included. Though I was not informed about the process, I'm trying to just go over it. Because the thing that I have prepared is for breast cancer awareness. As we all know that October is a breast cancer awareness month. Prostate cancer awareness month, I think, is in September. So since we failed to do it in September, it's just that the information was not correctly distributed. Cancer is there, cancer is rare, cancer is now considered as one of the chronic illnesses. Why? Because 1 in every 5 individuals develops cancer. So we need to be aware, we need to know that cancer is there, and we need to take precautions on it. So, can you please put the slide on? The first slide on for me, Ositanda. I'm just going to say a short prayer. Just a short prayer regarding prayer for all the people who are affected by this monster. Because it's either we are affected in a way that you are suffering from the disease, or any family member of yours suffer from the disease. So let us just bow our head and pray. Father, we thank you for this morning. Father, we are here in front of you to speak about the people who are struggling with this monster, cancer. We are praying for them to be strong and know that your faith and hope and love is with them. For all the family who lost their loved ones with this monster, we are praying for them. God, give them strength every day. Lord, also give me strength to give the information that is needed and to assist those who need information. Amen. Is my memory still not working? It's not working. it's fine. My introduction will be, why are we wearing pink today? Why are we wearing pink? We are wearing pink and having this pink ribbon to support all those who were affected, who suffered from the disease itself, and all those who lost their family member because of this breast cancer. We are also wearing pink to spread the disease itself, that is the breast cancer. Now, what is this breast cancer? Breast cancer is a disease where abnormal cells grow uncontrollably and form a tumor. Unfortunately, for the 7 o'clock people, I showed them this picture. This picture is appearing in my memory stick. You could have all seen the abnormal growth of cancer cells. You see there are two breasts. The breast on my right side is a normal one, and the breast on my left side is the one with abnormal multiplication of cells. By the way, we are all having cancer cells in our bodies. They are inactive unless being stimulated by something. Then they become active. So breast cancer is the most common cancer in women. It is a number two killer disease after lung cancer. Lung cancer is a number 1 killer disease. Breast cancer is a number 2 killer disease. It affects women of ages 35 to 54, but also it can affect teenagers as early as 20 years of age or 18 years of age. Why this age? Is because our body are continually having cells that are dividing and multiplying. There is mitosis that is taking place. The cells are dying, the new cells are formed. So, as you see the age 35 to 54, at that stage, the cells in the woman's body are very, very active. They are multiplying, they are dying. So at the same time, the cancer cells is also interfering, goes together with the cells, mimicking the cells, and then as time goes on, it deviates, and then it feeds from the cell and grows abnormally and causes cancer. Cancer can also affect males, but in males, their incidence is very low. It can only affect 1 in 100 males. 1 in 100 males develops breast cancer. Sorry, I forgot to ask you that. Should you have any question there, just pack it aside and then you'll ask me when I finish. But if one may ask why males are affected in this small percentage, is because males are only having one hormone, that is progesterone. The women has got 2 hormones, progesterone and estrogen. And cancer is more active in the estrogen. That is why you see it is affecting the younger generation, because at that stage they are still at the childbearing age. The cells are multiplying, they are still having their menstruations. And then after 54 years is when we reach menopause. Cancer can also develop after menopause. It doesn't develop after menopause. It can develop, but chances are not as high as in the menopausal stage. Because after menopause, now the estrogen becoming active. Estrogen is now manufactured in the fat cells. And then as you know that as you grow old, we are becoming fat, we grow a little bit of weight, the breasts are gaining weight. So breast cancer can also affect people post-menopausal. The cancer survival rate has improved because of early diagnosis and variety of treatment that is now available. What causes this cancer? The exact cause is not fully understood, but it is believed that it is a combination of genetic, environmental, and lifestyle factors. Genetic in the sense that if you have any member in your family that is affected with cancer, you are likely to develop any type of cancer, even the breast cancer. Environmental factors include the air pollution. As you see, our city, our country has got a lot of factories and there's a lot of smoke. Some of those smokes contain lead, and lead is very detrimental to our body as it activates the cancer cells to divide, to multiply. And also the chemicals. The chemicals that we are using in the factories, the chemicals that we are using in our home as well. And then lifestyle factors. As you see today, we have got our lifestyle has changed a lot as opposed to our grandmother and grandfather. They used to eat organic fruits, organic vegetables, and even the organic meat. Now, in today's lifestyle, the chicken is being brewed today. Don't sleep, the chicken don't root the chicken are sleeping. It is being brewed today. Tomorrow, the chicken is a big chicken, you eat it. The vegetables are being fertilized with hormones. We are using micro ovens, we are using air fryers, we are using a lot of new things. Everywhere is development. It's a new things. We cannot stop using it, but some of them are detrimental to our health. So those are the causes of breast cancer. The risk factor, as I said, is family history. That is genetic inheritance, personal history, that is previous diagnosis, especially with invasive breast cancer, ovarian cancer, or endometriosis. Obesity, poor physical activity, smoking, radiation exposure, even low level of ionizing radiation. That is why you see people who are working in X-rays, people who are working in radiation oncology, they are wearing their protective clothing to protect them to get that small portion of ionizing radiation. And also hormonal exposure, example hormonal replacement, hormonal birth control, especially at an early age. Please people understand me. If I'm talking about hormonal replacement, I'm not a doctor, I'm a nursing sister. The doctor might have intention when giving you the hormonal replacement. So those who are on hormonal replacement, especially the postmenopausal one, don't stop hormonal replacement and say you are afraid of breast cancer. Yours is to take treatment, but to take extra caution. And then the hormonal birth control, it also contradicts itself because our Department of Health is saying that we should introduce the family planning to children at the age of 12 years. But at the same time, as the child goes on, it causes detrimental effect on the life. So this is a dilemma. So, yeah. Also, early menarche, that is before 12 years. Menarche is the onset of menstrual cycle in girls. So, the normal onset menstrual cycle is different. The others can get it at the age of 10, 11, 12, and upwards. But as long as it is less than 10, then it poses the child to be the high risk of breast cancer. Also, late menopause. As I was talking about menopause, some people menopause earlier, some people menopause late. Because the age for menopause actually is from 55 upwards. So other people menopause at 57 or 58. So that also poses you at the risk of developing breast cancer. Nulliparous. Nulliparous is the one who never get pregnant. Yeah, I'm not encouraging you to fall pregnant. Never once. As I talked that breast cancer, they thrive more in estrogen. Estrogen is the one that is more involved in division of cells and during menstrual cycle. So you can imagine being in a long exposure on that estrogen. That is always where your cells is multiplying or menstruating. So it can pose you at the risk of developing breast cancer. Also, the first pregnancy after 31 years of age, it goes to the same thing. Because at 31 years, the breast tissue is composed of immature cells that are more active. The first cell of pregnancy causes these cells to mature and some of them to die. So if you don't fall pregnant, or if you fall pregnant at a later stage, then those cells will have matured. Signs and symptoms of breast cancer is a mass or lump in a breast, change in size and shape of the breast, change in breast skin that is thickening, dumpling, and orange peel-like appearance, change in skin temperature and pink color on the affected area, unusual discharge from the breast, either blood from the breast or pus from the breast, change in a nipple such as retraction or erosion around the nipple. I'll talk more about that when I talk about the self-breast examination. Unusual discharge from the breast, swelling under the arm next to the breast. Pain, you can only experience pain if cancer is already in an advanced stage. Prevention. We can prevent breast cancer by doing self-breast examination, by going for mammogram, and then if they find any growth or lump in your breast, they can do the biopsy. So I'm going to talk about the self-breast examination. This picture could be appearing in the screen as well. When you do the self-breast examination, I don't know if you'll be able to hear me because I want to demonstrate this. Am I loud enough? Yeah. Can you hear me? Yes. When you do self-breast examination, we will use the acronym TLC. That is touch, look, and check any changes. So women, please apply tender loving care to your breast. Then, when you apply this tender loving care, you stand in front of the mirror. You stand in front of the mirror like this. You see, when you stand like this, you are exposing your breast. Then, under normal circumstances, women, our breasts are not equal, but it's our secret. Then nobody knows. The breasts are not equal. So when you look at your breast, never mind about the inequality. But if the inequality is deviating and becoming more, then you must start worrying, because that will indicate that there is a growth somewhere in your breast. So you look at your breast like this. As you stand like this, the nipple will be exposed, and then you'll be seen in the retraction. Retraction is like the nipple is going inside. If the nipple is going inside, it means that something is pulling from the back. And then you will also see the orange-like peel. Orange-like peel. It's like, you see the dimples like, it can be something, but it's like an orange peel. And then you will also see, I talk about the size, you also see the size of the breast. And then as you examine your breast, when you express the nipple, if there's an abnormal discharge that is coming out, either the blood or the pus, you must be aware. So as you standing like this, after standing like this and doing checking and looking, T stands for touching your breast, L stands for looking, and then C stands for checking. So now we are going to check our breast. If you check the left breast, you put this arm behind your head, and then we have got 3 methods of self-breast examination. We have got It's just unfortunate. I'm very, very sorry for the inconvenience. Man.
Slides are there.
Oh yeah. Thank you so much. I was wondering. Go to the next screen, please. Go to the next screen. To the next slide. Yeah, this is the self-breast examination. As I'm not finished. I want to demonstrate the self-breast examination. So I was saying, when you examine the left breast, you put the hand behind your head, and then you use this part of your hand. Don't use fingers. Yeah? Use this part of your hand, and then you start under the arm like this. You go like this, like this, like this. Can you all see? I'm sorry for those who can't see. Until you reach the nipple, then you express. Then, or you can do like this. Or you can do like this. Every time after finishing, you express the nipple. By doing this demonstration, there is no way that you can miss any growth in your breast. Can you please go to the first slide? To the first slide. First slide, the first one. Yeah. Where the breast is appearing. You see the normal breast is on your left side, né? So as you are doing palpation, you will be feeling small little lumps that are running away as you palpate your breast. Those are the normal breast nodules, né? The breast cancer tumor, when you do the palpation, the lump is just staying there. It's not movable. So once you're doing self-breast examination and you find that you have got a lump that is fixed, then please go for help. Okay? Go to the next slide. Can you go up? No, up. Yeah. This one is not so visible enough, but it's basically what I was demonstrating for you on self-breast examination. So, when is the time to do the self-breast examination? For those who are menstruating, you can do it 2 to 3 days after menstruation. The reason being that some people before menstruation, the breast becomes engorged, it becomes very sensitive, it becomes painful. So you can mistake it if you do it before you menstruate. So do it 2 to 3 days after menstruation. Those who have reached menopause, you can choose any other day and do the self-breast examination. When doing it, you can either be standing in a shower, or you can lie flat with a pillow at your shoulder blade, or you can simply be standing. Okay? So we are going to do the stages of breast cancer. We have got 5 stages of breast cancer. Why 5 stages? Because stage 0 is where the cancer cells is in your system but is inactive. The cancer cell might be in your breast but is not active because it is not stimulated by anything. So, just go up. Oh, no. Just leave that picture. I'll leave it here. So stage 0 is the one that is written ductal carcinoma in situ. You see, there is the breast, there is nothing appearing in the breast there. And then stage 1 is the early stage of breast cancer. You see those red dots. Cancer is now starting to be active. The cancer cells have moved from original location into normal breast tissue. And then stage 2 is locally advanced breast cancer. As you can see now, the multiplication of cells now is increasing. The tumor is either smaller than 2 centimeters but has spread to the underarm, lymph node, or larger than 5 centimeters and may not or may have spread to the lymph nodes. And remember, once the cancer is starting to spread into the lymph nodes, it multiplies very quickly. And for some reason, most of the time the left breast is affected. And then the stage 3, cancer has spread into the nearby tissue and lymph nodes. Those 2 stages, the stage 3 and stage 4, those are the danger stages, but it can still be managed. Stage 4, cancer has spread to the distant organs outside the breast. Now we don't like stage 4 in breast cancer because in this stage, either the tumor has grown big, it has started to fungate, that is, it has started to give all the discharges, or it has started to be smelly, or if not, the tumor is just big and contained inside the breast, and then it might multiply somewhere in your system. It might go to your brain, it might go to your spinal cord, it might go to your liver, it might go to your lungs. So stage 4 is the most dangerous stage in breast cancer. But anyway, as I said, because of treatment and researches that are done, cancer is no more a life sentence. You remember in olden days when you had cancer, you just have to stay and wait for your last day. But nowadays, people are surviving breast cancer. The treatment is also giving the good quality of life. So cancer is just a chapter in your life. It's not the history of your life. You can still survive with cancer. And cancer can be beaten. Having said that, in conclusion, understanding the stages of breast cancer is a vital part in your cancer journey. Each stage comes with unique challenges and considerations. Armed with knowledge, you can seek the right treatment. Having said that, we have a survivor amongst us who went through this journey. As the theme is saying, every story is unique and every journey matters. This theme highlights the individual and diverse experience of those affected by breast cancer from diagnosis, treatment, and recovery. So with treatment and recovery, you'll hear from Oschocho, as she's one of our cancer survivors. So before Oschocho comes, let me just browse through the prostate cancer. Okay, prostate cancer, as I said, we all have cancer cells in our body. Again, prostate cancer is an uncontrolled growth of abnormal cells now in the prostate gland. Early signs has no symptoms, but as it progresses, the symptoms appear. The risk factors is old age, family history, exposure to some chemicals, lifestyle choices, smoking, race. For some reason, they think it affects more African men than other races. Diagnosis is done by blood test, digital rectal examination, biopsy, imaging tests like MRI and CT scan. So I'm urging all the fathers, all the brothers, all the sons, from the age of 55, you must go and test for your prostate. When you test for your prostate, they take blood. They call it PSA, which simply means prostate-specific antigen. With this blood test, they'll be able to see if you have cancer cells in your system. The normal value for this PSA should always be less than 5. Once it is above 5, it is a danger. So the digital rectal examination, I know most men are afraid to go to the doctor to check for the prostate, because what the doctor does is, the doctor inserts a finger in the rectum to see if there is any growth or there is any lump in your prostate. So please don't be afraid, because early detection saves lives. Right? The treatment option for prostate cancer is surgery, that is radical removal of prostate gland if cancer is localized. And then if cancer is already spread, they can do radiation. There's also hormonal therapy. The hormonal therapy is used to block the testosterone. And chemotherapy can also be given. Or cytotherapy. By cytotherapy, they freeze and kill the cancer cells. The signs and symptoms of prostate cancer. You have frequent or urgent need to pass urine. But when you go to toilet, you feel like you are passing urine, but when you go to toilet, you pass just a little bit of urine. And you feel like your bladder is still full. And then there is weak or interruption urine flow. You all know, I'm going to name and shame, but so you all know males, when you pass urine, the urine has to go like this. Once the urine is going like this, then there is a problem. There is a growth somewhere. And then there is pain or burning during urination. And then there is trouble in starting or stopping urinating. As I'm saying, you feel like your bladder is full, you go and urinate, and then the urine will come out, but the urine will keep on dripping. As a result, you spend more time in the toilet as more than usual. And then there can also be blood in your urine. And then you can also have erectile dysfunction or pain with ejaculation. And then you can also have persistent low back pain. And then when cancer has spread to other organs, because it can also spread to the chest, it can spread to the back, it can spread to the bladder. Then you will start having this cough that is not going away. You start having the bone pains. So, stages of prostate cancer. Prostate cancer is confined to the prostate. It's stage 1. And cancer in prostate, the cancer is in prostate, but it's more advanced. That is stage 2. Stage 3, cancer spread to the nearby tissues. And stage 4, cancer spread to the distant organ. So, those are the symptoms of prostate cancer. So people, let's take care of ourselves. Let's support the people who are struggling from this monster cancer, because we have different types of cancer. We've got child cancer, we've got colon cancers, which is also now becoming more common, especially in males. We have got bone cancers, we have got blood cancers, we have got all the different types of cancers. So please, let's support the people who are living with this disease. It's only through our support that they'll be able to go on and on and on. Having said that, I'm giving Osocho a chance to come and tell us about her journey, her unique journey, and the journey that matters to her. Thank you very much.